Okay, Gothenburg, I show 4 o'clock, so we'll go ahead and get started. Appreciate everybody taking time to join us today. I read a quote last night that I think reminded me of the current situation we're in. The quote was, "Adversity doesn't build character, it reveals it." And I think that's very true for what we're seeing in Gothenburg today. I'm really proud of everything that everybody in the community is doing to make this time more manageable for those around them. I think about a concept that we talked about a couple weeks ago, a trash pickup challenge that a local family presented to the community that is spread through social media. I think there's been close to 30 miles of trash around Gothenburg picked up as a result of that. Other positive things, it's really fun to see what our different businesses are doing to evolve and continue to have fundraisers. I think of the Sun Theater and what they're doing on April 24th with Rascal Martinez. They're offering for Rascal to come to your house to do a performance, to raise money for the Sun Theater and to promote social interaction while participating in social distancing. It's very fun to see what our community's doing. The Meals on Wheels continue to go very well at the Senior Center. They continue to have excellent volunteerism. From time to time, they may run short on delivering meals. So if that's something you're interested in helping with, please make sure to let them know. They had a great fundraiser this week, making rolls for the upcoming Easter holiday. It's really fun to see how our community is coming together. In the spirit of coming together, last Friday night, there was a cruise night organized by a community member. So many members of the community met in the school parking lot and then cruised up and down Main Street. It provided to be a great opportunity to see each other, but practice safe social distancing. And by the way, if you haven't noticed, fuel's under $2 a gallon right now, so it's a perfect time to do some cruising. I don't think since I've been in high school did I remember seeing fuel prices as low as they are right now. As a reminder to everyone, if you have not signed up for the Chamber newsletter that Deb maintains for us on this COVID situation, please do. There's a tremendous amount of great information available that Deb puts out there. Recently, there was an update that talked about how we should be talking to our kids about what's going on in the world around us. Some great information. There's information in there promoting takeout options to support our local businesses. So if you haven't signed up for that, I would strongly encourage you to. All you need to do is email Deb at the Chamber. She'll put her email address in the comments section of the chat section of this dialogue. And if you haven't already emailed her to sign up for that, I would encourage you to do so. So with that, we're gonna have the hospital start us off with an update from the medical community. So Dr. Dalrymple, how's things going at the hospital?
Pretty good, I think. Thank you, Nate. So I'd like to just give an update similar to what we've done in the past. So first, an update based on what's going on in the state. We have, as of today, over 500 cases. That was kind of a benchmark this week, yesterday. And just to compare the last meeting that we had just around 150. So it's kind of a big jump even just in a week, which is kind of what we would expect. We have had 14 deaths in the state. Last week we had only 2 reported. Still a lot of activity in Douglas County where Omaha is, but now we really are starting to see a lot happening in Grand Island, in Hall County, as well as in Kearney and in North Platte. So I think that's important to know that it is coming this way. In our health district, we have a total of 34 cases, I believe, is where we're at today. And in the health district for North Platte, we have 17. Just in comparison to other states around us, Colorado has over 5,600 cases. So it's a big jump compared to us, but they're not very far away. There is documented community spread here. That's been going on for a while. Nationally, we have over 400,000 cases in the United States. So it does continue to rise. So with that, I'd like to talk a little bit about the hospital and what's going on there. So we are still seeing patients. We continue to have a sick and a well side where you are screened at the door, and if you have any concerning exposures or signs or symptoms, you wear a hospital mask and go to the sick side. We also do, that kind of brings me to something we're going to talk about with masks. And before I do that, though, I want to bring up too that we are doing some telehealth now, which I've done a few of those visits last week, and I thought that went really well. So that's an option if you really don't want to come in, and it's something that we can talk about or visually look at. I think that's always a good thing to make sure people know. So a note on masks, as a lot of people know, we have, they made some changes in the CDC recommendations over the past week about wearing masks, that they now recommend that the general public will wear a cloth mask or some kind of facial covering to wear out in public. So going to the grocery store, pharmacy, post office, places like that. And this is I know that there's a great visual that you guys have on the difference between what you should wear out in the community versus at home. Do you guys want to put that up? I know you guys are in charge of all the technology stuff, which is good. So while they're getting that up, we'll talk about the, kind of the difference. So a facial covering of any kind is, here's that visual. I think that looks great. So that picture, if you have access to actual hospital surgical masks or N95 masks, I think you'd be doing a great service to community to donate those to some kind of hospital organization. And so cloth masks are for outside of the community. So again, I'd like to just talk briefly about why this is important and what the goal of wearing masks is supposed to be. So a cloth covering for a mask is not going to prevent you from inhaling any type of coronavirus that's in the air, like an aerosolized virus. But what it will do is it will prevent you from sneezing or coughing and potentially exposing pretty much anyone else that you might be around or within contact. So the foundation for that recommendation is kind of contingent upon everybody wearing a facial covering in public so that we are protecting others if we are potentially infected. And this comes along with some news that came out last week about the fact that up to 25% of people can be asymptomatic carriers. More people than we thought can have the virus but don't have symptoms, and just kind of an increased awareness of how it spreads. So by contrast, when you're wearing an actual N95 respirator, that's actually preventing the person who's wearing it from contracting the disease. And so that's why that's so important for frontline healthcare workers to be using those so that we can stay healthy. So that's just a couple notes on masks. And again, I know that we're going to talk more about that in terms of the community later. So I wanted to bring up, though, that we at the hospital have increased who's wearing masks to try to help keep everybody safe. So a couple other quick things. I do think it's great to see that in our efforts seem to be helping flatten the curve. I think it's really important to not kind of loosen what we're doing and saying we're going to go out and start meeting and stop social distancing or those mitigation efforts. I think that's really important to still continue. All the prediction models that I've looked at say that the peak is going to still probably be at the end of April in Nebraska. So really what we're doing is helping, and I'd really encourage people to continue to do that, to not stop. We really don't want to surge in this area, but if we do, the hospital is preparing in every way that we can. We actively monitor what personal protective equipment that we do have. We have looked at various scenarios for if we would need to have more people than the number of beds that we currently have. We've looked at that, as well as how to take care of patients in any way that we would need to, including if we would not be able to transfer a patient that would need to stay here. So I feel good about what we've done and confident that we're working hard to make sure that we can take care of patients. So with that, I'll look through my notes and make sure I didn't have anything else I wanted to share. I would just again, continue social distancing, avoid those groups over 10. Those are part of the directed health measures now in our state. That's really important. Washing our hands all the time, and then now wearing those facial coverings out in public are the recommendations. And still, use our technology to our advantage. So, mentally, this is still hard to stay at home and to not be part of the communities that we are. So continue to support each other and reach out via phone or FaceTime or text or whatever to your neighbors and your friends. I think that's good. And then the last thing that I'll just bring up is there are some potential new guidelines that are going to be coming out from workers that are considered an essential worker. They are thinking about allowing people to go back to work who've been exposed to someone who's been diagnosed with coronavirus if that person is not symptomatic and if they wear a mask and check their temperature twice a day. And again, those are for essential workers. Now, that's not a recommendation that has officially come out yet, but if people have seen that kind of around, that may be coming. And I think that's a sign of the attempt for everyone to kind of start reopening businesses and trying to get back to some kind of normal. It's not going to probably be that way for a while, but trying to do that. So with that, I'll give it back to you, and hopefully if I can be here to answer any questions that there are as well.
Yeah, and I've heard of some businesses taking time during the day to do temperature checks, or maybe first thing in the morning as people are coming in. You have any thoughts on that?
Yeah, I think that's a great idea. It is recommended for businesses that are continuing to stay open, essential businesses and people that do potentially have to work, pretty close together, or, even if they're still doing 6 feet apart at work, that is definitely something that we recommend. That's part of the CDC recommendations as well for businesses that are still open.
Yep, good. Perfect. We appreciate that. I think we were planning on having a couple representatives from Two Rivers on, Jeremy Eshelman or Catherine Mulligan. I don't see either one of them in the queue. So if they are, if you could maybe try to get word to Will. Otherwise, we're just going to transition on to Dr. Rhodes and get an update from the school. So thank you, Dr. Dalrymple. Appreciate it.
Yep.
Thanks, Nate. Good afternoon, everyone. Right now, in compliance with Governor Ricketts' DHM as of Wednesday evening, we're in closure to students through May 31st, so that subsequently ends our physical year with kids. And I would just reiterate that is physical year with our kids. We will continue to provide our e-learning opportunities for each and every one of our students in the Gothenburg Public School District and continue on with our remote learning. Our instructors are working very, very hard with our kids. The other thing we will continue to provide is meal services to those kids that have signed up for that program. We are currently providing meals on a daily basis in the range of about 400. One of the changes that we did make with our food and nutrition staff is that group is wearing masks on a daily basis when they come to work, prepare the food, when they hand the food out to parents and kids when they come by to pick those things up. We have established appointment only personal pickup of student personal belongings, and parents can contact their building level principal and they will set up a personalized time for parents or students to come in and pick up their personal belongings. And we're on a daily basis, we're having conversations about some of those capstone events that happen in the spring for our student body, primarily the class of 2020 and graduation and prom. We right now have indefinitely postponed graduation and prom until we get a little bit further down the line and we get more guidance and recommendations from the state of Nebraska as well as our health officials on setting a date. We have every intention to honor our class of 2020 with the graduation. When and what that looks like right now is kind of the unknown. But I will tell you, the administrative team at Gothenburg Public Schools is working on several different plans as it relates to graduation and making sure that we honor our seniors and send them off the way they certainly deserve to be sent off.
Great. Well, thank you, Dr. Rhodes. I have 4 kids that would normally be at the Gothenburg Public Schools, and a spouse also that would normally be at school. She's a teacher there. For anybody who has a chance to thank a teacher or thank a parent of a student, please do. We are, I'll say it again later, but Dr. Rhodes said failing forward when we started this e-learning experience for our students. It's amazing for me to see firsthand what my wife, a teacher, is doing from home to try to interact with her students. It's really fun to see from the students' perspective, from the kids' perspective, the education opportunities that they're getting from their teachers. We did do a Rule Goldberg experiment, or a Rule Goldberg at our house. That's where you throw the ping pong ball and knock over all the dominoes and you end up blowing up a balloon. That was a family experience that definitely had its high points and its low points, but education did happen in that. And so when you get a chance, please thank a teacher and please thank a parent of a student who is now part of the teaching staff for our students. So appreciate that. Thanks for the update, Dr. Rhodes. Joyce Hudson, Mayor Hudson, I will turn it over to you to give an update from the city perspective.
Okay, right now there isn't too much, but before we get into that, I would like to introduce our new city administrator. First of all, we want to thank Bruce for his 30 years of service. He will be officially retiring in June, and he is in the training mode with our new one, Gary Greer. And I think he's here to introduce himself and give you a little background.
Great.
Hello, everybody. So proud and happy to be here at Gothenburg. My wife, Cozy, and I have just been so excited about coming in here. Wish it was under different circumstances, but I've had experience managing in Kearney, Nebraska, in Grand Island, Nebraska, Manhattan, Kansas, and in the Dallas area. And I can tell you the effort that you're doing right now is second to none. And the ability to bring up 145 people together like we have right now to talk about these things that are important to everyone's health is just so incredible. And it just reinforces our decision that we want to become part of this community. I'm looking so forward after the virus threat is gone to really getting to meet everybody. I'm sorry I can't do that right now, but I think there's probably a pretty good reason. I take this very seriously, and as a city administrator, I'm really here to help our team become safe and healthy, and I want to do the same for the community. So looking forward to helping as much as I can. I guess I always usually end anything I say with some kind of meaningful words, I hope. Today, what I'd like to have everybody say is stay focused. We've got to be diligent. We can't give up on this, all these procedures that we're going through right now to keep everyone safe. And I think in the long run, it'll be a shorter run if we all stay focused. Thanks so much, and I'm so glad to be here.
Appreciate it, Gary, and a Gothenburg welcome to you and Cozy. We're very excited to have you as part of the community and look forward to the relationships that you're going to build. Bruce, a big thank you to you. Your tireless decades of service to Gothenburg. We are a better community because of your involvement. A huge thank you. We will find the right venue to thank you appropriately when the time comes and we can gather more socially. But thank you for all you've done for Gothenburg. Job well done. And I think you'll be able to find Bruce out of the golf course. A much deserved hiatus from the day to day. So, anything to share, Bruce? When I run the technology, it all messes up. Sorry about that, Bruce. Yeah, go ahead.
No, I don't have anything to add. I think I can certainly see where Gary's going to be a strong leader in our community, and I'm just looking forward to seeing what Gothenburg's going to do in the future. And I just want to thank everybody for working with me over all these years, especially mayors and councils.
Well, we're lucky that you're still going to be part of the community, but as a citizen, as opposed to involved in the day-to-day operations. So thank you again. So Mayor Hudson, any updates from the county level?
Yes, there's a couple things. One of them is in May 12th is primary elections, and the county is concerned about manning the polling places. A lot of the volunteers are in the age where that they're high risk for this virus. The state has told them they will get these polling places manned, but I think it would be safer if everyone would go ahead and send in, they should have received in the mail a little card that will let you get your ballot by mail. I've done it that way for years and it really works well. But anyway, you really need to consider this year to try to send it in and do it by mail. I think it's fairly self-explanatory. You can send in your application by mail, email, or fax, I believe, and then they will send you your ballot back. I have my ballot sitting on the kitchen counter waiting to be filled out. So please consider doing that this year in light of the virus that we have around. And the other issue is we've had some citizens concerned about their utility bills. I am speaking only on the side of the city, not the gas, but if you feel you have some financial issues and are concerned about being able to pay your bills, we really ask you to call the city offices. I think someone from the city is going to post a phone number and a email address. We'd really appreciate if you would call ahead of time and try to make some arrangements, or at least let the city know what the situation is. We are waiving the late fees right now. So anyway, hopefully Bruce or Gary will put up a phone number and an email address so you can address your concerns if you feel you might be struggling a little bit this month. And I think other than that, Nate mentioned it too. I just want to thank the community. They've been really creative and innovative in finding ways to keep ourselves busy, and yet, and I think we need to, we say social distancing, which is true, but it's more physical distancing. We can still be social, and we need to work on that and just work on our physical distancing.
Well said, Mayor Hudson. Thank you very much.
Yeah.
Appreciate it. With that, we're going to transition to Colton to give us an update on early childhood topics.
Sure, Nate. I'm going to start off by giving a big thanks to a couple groups of people. First off, the YMCA, and I mentioned this last week. The YMCA has stepped up and is providing childcare to frontline medical staff and some other frontline provider or individuals throughout the community. So they're doing so in concert with the hospital, and I know they've utilized the school lunch program a few times. So just a big collaborative effort in that regard. I think they had about 40 kids last time we checked. So if you put that into context, that would be the third biggest provider in our community behind Learning Adventures and Building Blocks if we were all operating. Basically, they did that by turning around on a dime and getting that set up. So a big thanks to the YMCA on what they're doing, and also our providers. We have some in-homes who are still providing care. Our two centers are closed, and our private and public preschool are also closed. But they're still communicating with their kids. My daughter's 3, she's in preschool with Amber, and last week they had a Zoom call with their whole class. So how cool is that for those kids to still be able to see their friends even at that young age? So a big thanks to those folks. So like I said last week, GECLC is not coordinating care at this point. Thankfully, we have that need met with the YMCA. But we have moved towards trying to assist the providers and their employees from a financial standpoint and from a resource standpoint. So we're happy to say through the Buffett Early Childhood Fund, I believe all of our providers locally were able to apply for a $1,000 grant from that fund, and that went live yesterday, and we were able to coordinate that piece. But from our perspective, the GECLC is just trying to coordinate making sure that our providers are aware of the SBA PPP loans, the unemployment rules, and also trying to figure out how we can get some of our funds to those folks. So just a forecast, folks will be getting letters in the mail over the course of the next week from GECLC, seeking community partnerships, so that hopefully we can flow some funds back to these people who don't make very much money as it is. To put it into perspective, an early childhood provider makes on average about $1,000 every 2 weeks. So this is going to hit home for a lot of people in our community, and our focus right now is trying to help support those folks. Thanks, Nate.
Absolutely. Thank you, Colton. And I think in one of our first meetings that we had, we talked about how this situation was going to come home to all of us by the people involved. And we've had a limited amount of COVID within the community, but the impact has certainly been on our workforce, on our workforce's access to childcare, and people's availability to make a living for themselves. So all the social safety nets that are available, we're trying to get the correct information in the correct people's hands. If you're in this meeting and you do need some help, reach out to the chamber office, reach out to your local bank, reach out to your local clergy. There are resources available. If you're in need, please make sure you communicate that need. There are a lot of people that are willing to help and wanting to help. With that, going to transition to Sean Kashke. Sean is with the UNL Extension. He's our area extension agent and has some updates from the university for us.
Thank you very much, Nate. I'd like to thank everybody for being on the call today. Like Nate said, my name is Sean Kashke, and I'm an extension educator with a focus on community development, serving about 8 counties in central Nebraska. I'd mentioned the last time, but the University of Nebraska Business Development Center, NBDC, so if you Google search business resiliency, NBDC, you will see a host of resources to help businesses, overviews of the CARE Act, of the many different programs. So I'd encourage you to check out the NBDC Business Resiliency resources on their page. If you're a startup and sort of want trainings to have some group chats with other businesses in the state, the NMotion Business Accelerator, which is a university-sponsored program, but it's in the Lincoln Industrial Park. It's called NMotion. It's called a generator program. And so, again, if you go to type in generator or NMotion in a Google search, you should be able to get access to that webinar series with business support. For general community support, like the mayor had mentioned, last year through the flooding, the University Extension started a disaster webpage, and that webpage is disaster.unl.edu. And again, it has mental health, well-being, some of the other topics. If you'd like a nice overview of that for mental health, for other resources as communities cope with disaster, please go to disaster.unl.edu. 4-H, I know a lot of you kids had mentioned, Nate, myself, we have kids learning at home, trying to keep them engaged in meaningful ways. 4-H has a living room learning video series, which is kind of nice to put on a video and then have the kids do an applied project. And if you type in 4h.unl.edu/living room learning, again, that's the 4-H living room learning video series. If you Google that, it'll show up for you too. And a little preview, Nate's going to give you a little overview of the CARES Act benefits locally. What we've been hearing from some of our Spanish communities across the state, Grand Island, Omaha, even Lexington, is we have trouble getting the information disseminated. And so my colleague at UNL, Sandra Barrera, who's a Hispanic business educator out of Grand Island, has translated a nice little one-page simple thing for the CARES Act as far as business goes. And so that might be shared a little bit later. I'm sure it'll be posted in the follow-up to this. So again, Spanish translation for the CARES Act. you can go to Cornhusker Economics, UNL Cornhusker Economics, and find that Spanish translation plus the English one, of course. And the last thing I'd like to mention, I know a lot of the audience in central Nebraska are larger ag producers, but for smaller ag producers, maybe ones that sell at farmers markets that have annual revenues between $10,000 and $1 million, there is an American Farmland Trust Relief Fund that you can either request $1,000 for or contribute to if you want to donate it to. It is limited to direct sale farmers. So I know a lot of our areas, they sell to elevators, which is not direct sale, but though we do have producers that sell directly to restaurants, caterers, schools, and that may be struggling. The American Farmland Trust has a special fund for that if you Google search American Farmland Trust. I think that's all that I have for today, Nate. Thank you for the opportunity.
Okay, appreciate it, Sean. Thank you, and thank you for the good information. We have posted those links you were talking about in the chat feature. So those are available within the chat feature for anyone that wants them now, and we will follow up with those in the update from Deb. So next, I'm going to talk a little bit about the business community and some of the things we're seeing there. Again, just a huge thank you to all the businesses that have made modifications to their day-to-day operations. I even think about our grocery store, who's now doing some curbside pickup. What a great way to keep the employees safe. What a great way to keep the citizens safe. So thank you for making those changes. We probably are going to continue to see more and more face masks in public. That's a good thing. I know my first venture out of the house is going to happen after this meeting's over, and I will be wearing a face mask. That's going to be the first time that's happened for me, and I'm a little self-conscious about it, but that's okay. I think as we see each other wearing those more and more, it's going to become a little more normal, and I'd encourage people to practice that, not only for ourselves, but for the other people. I think a lot of the changes that we're talking about making really are acts of generosity for other people. We're trying to protect other people as well as trying to protect ourselves. So want to talk just a little bit. Last time we talked about the stimulus programs. I'd say within about 2 weeks, it appears anyone eligible for the $1,200 per person and $500 for dependents 16 and under, those funds should be arriving within the next 2 weeks is what it looks like right now. There are some qualifiers. If you're married filing jointly, your income needs to be under $150,000. It's my understanding that if your 2019 taxes are filed, they would base that screening on your 2019 taxes. If your 2019 taxes are not filed, it will be based on 2018 taxes. If you're an individual filer, the phase out begins at $75,000 in annual income. So be on the lookout for those. In addition to individual supports, just a good reminder, the SNAP program or the food stamps program, talk to a local HHS representative. We've got a Health and Human Service office in Lexington and North Platte. They're both equipped to help with that program. Please reach out to them if your family is in need and you think you may qualify for those programs. Additionally, the Department of Labor, both in Lexington and North Platte, if you are going through unemployment, and you could benefit from talking to somebody with the Department of Labor, they're there to help file for unemployment. Moving on to the business community. I've been in the financial service industry for over 20 years, and I've never been more proud to be part of the financial community. What we've seen in the last 2 weeks is nothing short of amazing. In the over 20 years I've been in the business, I've developed relationships not only across the state, but across the nation. The people locally that are working on behalf of the business community is awesome. The local banks, the local accountants are putting in tireless hours to help our business community. There's been tens of millions of dollars of loans that have been approved that are waiting to get funded under the IDEALN program or the PPP loan program. The collaboration that's happening between financial services companies is amazing. Early this morning, before 7 o'clock in the morning, I was on the phone with John Krusher. He's the senior lender at First State Bank next door. That's a competitor of ours, Flatwater Bank. But we're working together to try to figure out how to help our business community. We're tripping over each other to try to help the business community have access to these funds and keep keep these businesses' doors open. At a very high level, if you own or operate a business, you need to talk to somebody in the financial services industry if you haven't already. Your accountant, your banker, your financial advisor. Those people are here to help. They're collaborating on your behalf. The benefits to you talking to somebody to gain information about these programs can be extremely meaningful. Some of the loan programs could have terms of up to 30-year financing at 3.75% interest. There could be up to a $10,000 grant. There could be up to 2.5 months worth of your payroll expense forgiven. There are many, many opportunities to help businesses through these tough times. I will say again, work with the financial professionals in your life. They are putting tireless hours in. Every one of the local financial professionals I've probably been in contact with before business hours or after business hours. They're working on behalf of all of you, the business community. In talking to other financial service providers outside of this area, not everyone is taking the same approach that your local professionals are. We are very lucky to have extremely engaged local providers of financial services. We've talked about it many, many times. We all benefit as the community benefits, and we're in this together. There's a significant amount of federal funding that has gone into these programs. The first version of the stimulus was $349 billion. Those funds are being put to work, which is very good news. There's proposals right now to expand that funding for another $250 billion. Specifically for ag, $9.5 billion has been earmarked to go through the USDA. The saying that we have stolen from Dr. Rhodes is we are failing forward on this. It seems like we get issued final regulations until they change the next day. We literally had program applications put together, submitted, ready to go, until we got up the next morning and we saw the forms had changed and the rules had changed. And so it's back to the drawing board again. And we continue every day to fail forward on behalf of the business community. So couldn't be more proud of what we're doing. If you or your business, or if you know somebody's business that you think may benefit, talk to a professional, talk to your local banker, talk to your local accountant, talk to your local financial advisor. They're equipped with resources to help you. I really encourage you to walk through many of these doors that are open to you. With that, I'm going to transition to Matt Williams, our local state representative, coming to us from Lincoln.
Well, thank you, Nate. I really appreciate the opportunity again. I've never, as you mentioned, been more proud to be part of a community than I am right now, watching what's happening in Gothenburg. There's just a few brief things and comments I'd like to make. Dr. Dalrymple mentioned that she had done a few telehealth visits recently. I want to give a big shout out to the Nebraska Medical Association, our Department of Insurance, and even more importantly, our private insurance carriers for stepping up to the plate to cover telehealth visits on par with in-office visits. That's not been the normal way that this has been done. And our insurance companies in Nebraska, recognizing the COVID situation, have stepped up to provide help in that area. You were just talking, Nate, about the small business programs. It has been short of incredible what has happened in the state of Nebraska. Applications were just opened up last Friday, and as of yesterday, there have already been 8,000 paycheck protection loans applied for and accepted, amounting to $1.5 billion, and that's billion with a B, dollars in loans to small businesses in Nebraska. Tomorrow, on Friday, the application process opens up for those that are self-employed and independent contractors. So I think we'll see another bump there. But I would like to just emphasize what Nate was saying is We are so fortunate to have banks and bankers and financial advisors and accountants that are engaged with this process. But we can't lead every horse to water. So if you or someone that you know could take advantage of this, please encourage them to call their bank or their accountant or financial advisor. Mayor Hudson talked about voting. We will be voting in the primary on May 12th, as she mentioned. We have no ability under state law in a county the size of Dawson County to do a total mail ballot. But each one of us can take the responsibility ourselves to request a mail-in ballot. It's very easy to do. You can do it either by calling the Dawson County Election Commissioner office at the county courthouse. You can go online to the Secretary of State's website and fill that form out. And you have until May 1st to do that. Following May 1st, you can still go into the courthouse to vote privately, but that becomes problematic also. The other thing I would point out with the voting, and Mayor Hudson mentioned this, those poll workers that have traditionally been in a category of being senior citizens that may be at higher risk, polls will still have to be opened, even though we hope there will be a lot of mail-in ballots. So our county election commissioner is looking for more people to help man those polls. You are paid to do that. It does not count against unemployment compensation if you're on unemployment. And the Secretary of State will be providing protective gear, including masks, gloves, alcohol wipes, all the things that you would need. So if you're inclined to want to help, I think a call to the Election Commission office at Dawson County again and volunteering to do that would be helpful. The last thing I would point out today is the governor just this afternoon in his press conference announced a new proclamation that we are going to try to stay home, stay safe, and stay connected for the next 21 days. As Dr. Dalrymple mentioned, the peak is predicted to be later in April. So the governor is requesting through his directed health measures to have all of us stay home, stay safe, and stay connected for the next 21 days. That would be the end of April, 1st of May. So with that, I think I will close. It is again up to us individually to be the example, be the one that does wear that mask, be the one that makes the decision to stay home as much as possible, except for those essential trips, and do the best we can to flatten the curve. Thank you.
Great. Thank you, Senator Williams. Okay. We had alluded to it earlier, but we're going to get a little bit more information on face masks from Becky Jobman and Dr. Dalrymple. Becky.
Yeah, so just wanted to kind of echo off what Dr. Dalrymple had talked about as far as the CDC guidance that everyone wear a face covering in public. Gothenburg Health is actually challenging the community to help us come up with 500 homemade cloth masks by this Monday. There have been a number of donations already, and we're tasking, challenging our community to help further that cause. So I do want to clarify on that we will use these masks to ensure that all staff and visitors can wear a mask, and that that helps to further prevent spread of the virus. And Dr. Dalrymple said it also helps to contain the wood. But I do want to note that all clinical personnel will wear medical grade masks. That's really important. And so the cloth masks will help free up and protect some of our supply of medical grade masks so that we don't burn through that really peak. So with that, we have some links and contact information, and they'll get that into the chat here in a little bit. So we have a point person, Trudy Chestnut. She's our executive administrative assistant, and she'll kind of be your contact person if you are interested in donations. And we kind of have a desired pattern as well. And so all that information is posted to our Facebook page. It's a pinned post. It's the first post you'll see if you scroll down, or you can go onto our website. and you can see all those links that they have there. One link actually takes you directly to the PDF of the face mask. So I think that that's about all I have. Dr. Dalrymple, do you have anything to add to that?
I don't think so. I think that sounds great, and I know that our community can do that. So if I wasn't working at the hospital, I'd be sewing too. I like to do that on occasion, but yeah, I think that's great.
Great. Well, maybe we need to get the hospital coordinated with 4-H Extension through UNL to offer some sewing tips on how to make these masks. Yeah, maybe a little bit of a contest for who can follow the guidelines the best. We could get some judging to happen. So yeah, great, awesome way to engage. And I know everybody's looking for a way to help. I think that's been one of the fun things for me to watch as we've gone through this crisis. Many people have asked, how can I help? What can I do? And here's just a great example of something that people that they can do it in their living room. They can make a difference and really have a positive impact on the greater good. So yeah, thank you for the idea. And again, Trudy Chestnut at the hospital would be the main contact to get more details, correct?
Yes, that's correct.
Okay, perfect, great. Next, want to transition to Reverend Jamie Norwich McGlennon. So Reverend Jamie is with us from the Ministerial Association. What a big weekend we're just about to embark on, which would normally entail a lot of community gathering. But because of the social physical separation, that's going to be more difficult to do this weekend. So with that, maybe give us an update from the Ministerial Association.
Thanks, Nate. I'm delighted to be able to bring some word from the Ministerial Association. We have worked really hard, the churches in town have worked really hard to find a way to continue to gather with our folks, since our business really is about gathering and creating community. It's been important to find new ways, and pretty much all of our churches are offering services either through Facebook Live, or through Zoom, a variety of different things for Bible studies as well as worship. And this weekend, Deb has put together a wonderful list of the services, when they're being held, who's working with whom, and I'm very grateful for the work that she did to put that together so that people can find out where the services are. I tend to do some of our service. I'm over at the church just in case somebody does stop by, and we have had a couple of people stop by looking for churches, and we've had to direct them and redirect them. But even though it looks like we're closed, we're really not. And we continue to gather, and we continue to do the work in our community. It is Holy Week. You can find services tonight and tomorrow night and on Sunday as well. I think I maybe even saw at least one service that's on, there are a couple of services actually that are on Holy Saturday. So check out the information that Deb has put together. That's on that information sheet that Deb's been sending out through the chamber. So please check that out, because it's got some great information on that. But I also wanted to let you know that our churches do participate in helping to take care of those who are in need. And so we have somewhat limited funds, certainly limited in comparison to what the numbers that have been listed, but we do have opportunities to be able to help people out either through the food pantry or through some small funds to help pay some of the bills that maybe need to be cared for. And so the Ministerial Association is something that gathers funds from a variety of different places when we have fundraisers, and we share it back to the community. So we have great churches in the community. We work together a lot of the time, and I have thoroughly enjoyed doing that and being a part of that here in this town. Like almost everything else that happens in Gothenburg, it is very much community oriented, and you can be proud of the churches and the work that we do together. I went out today wearing a face mask, and I felt foolish, but it is what we're being called to do. And so, yes, I think it'll help when we all start wearing masks and we don't feel quite so silly being the only one out and about with one on. So John Wesley, who's the founder of the Methodist Church that I serve, he had his one rule, his first rule for the way that we worked is first, do no harm. And that's what we're trying to do by not gathering together in the large groups that we do. For funerals, for weddings, a variety of those are being scheduled at different times, at later times, so that the groups can come together. Tim has been working really hard. Tim and the funeral home have been working really hard to help work with people on those kinds of moments. And we've had several weddings that have been delayed so that they can have their larger gatherings. Contact your clergy, work with your church, and we will make sure that those things happen when we can gather together again. And until then, we will work with families to help with grieving process or celebration process. So that's about all I have to say, except this is a great community to be in. We have volunteers and we have people who believe in helping one another, and it's a great place to be.
Great. Thank you, Reverend Jamie. It was fun in a conversation Reverend Jamie and I had earlier today. She shared, we're choosing not to gather because we love one another. And
there you go.
That's one of the conversations they've had amongst the Ministerial Association. And what a great example that we do care about each other. And because we care about each other, we're choosing not to have those face-to-face interactions. However, we still can have those community experiences in a virtual way. So a big thank you to the churches and all the other community activities that have found a way to have a virtual experience. When we were trying to set an agenda for today's meeting, had Amber forward a poem that her daughter Taylor had actually sent to her. And it was a really fun part of my day to take a few minutes and read a poem. So we've asked Taylor to join us today and read that poem for us.
Yeah, so it said, if Dr. Seuss wrote a poem about COVID-19, it says, the buildings were big and people would smile, travel they would, mile by mile. But sick they become, in numbers it grew, businesses worried, communities too. Things stopped for a bit, the world slowed its roll. The virus had certainly taken its toll. But what they then saw is, in fact, from slowing things down, they now had less reasons to frown. Families now gathered, what game shall we play? Pass me the blue crayon, give mommy the gray. Daddy is home, guys, he'll read us a book. Then all of us together will cook. The lungs of the planet caught a small break. Less travel meant less pollution to make. People did realize that they'd all be okay. They don't need so much to get through the day. Maybe this virus that caused so much stress showed the whole world that more can mean less.
Great. Thank you, Taylor. Thanks for sharing that with all of us. Really appreciate it. Well done. Good reminder for all of us, keep looking for the good. Keep looking for ways to help people. Keep looking for ways to make a difference. Thank you to everyone for what you're doing to help us get through this. And we're Gothenburg. We're going to come out of this stronger. Thank you.